Hello everyone, myself Gineta, working as an assistant professor, Department of OBG Nursing in Kahir Institute of Nursing Science, Kolkata. So today I'm going to take a class on the topic episiotomy wound care. So let us see now what is episiotomy and how are we going to give wound care. So episiotomy is a planned surgical incision that is made on the perineum and posterior laminal wall to the late second stage of labor in order to widen the introitus and straighten the lower end of the throat canal. So this is done in an attempt to prevent the muscle and tear as the fetal head is delivered. So now we should not forget, as we mentioned, that it is given during the late second stage of labor and also at the time of contraction. Then it is given in the perineum and the posterior vaginal wall. So what is the definition of the episiotomy wound care? It means cleansing of the vulva, perineum, and the anal region to prevent the infection, promote healing of the staged perineum, and make the patient comfortable. So, what do we actually do during the episiotomy wound care? So, we are going to clean the vulva, perineum, and not to forget the anal region. And we should also remember, yes, very important point, that we should not come back. Once we clean the anal region, we should not come back with the same cotton. Then next is also, yes, we have to make the patient comfortable, as if the perineal region is unhygienic, or if there is a bleeding, or if any signs of infection are there, then the woman will not be comfortable. So that is why make sure that by giving the episiotomy wound care, the woman is more comfortable. So what are the purposes of giving the episiotomy wound care? First is to cleanse the perineum and the vulva. Next is to observe the amount, color, then odor and consistency of the lochia or vaginal discharge. Mentioning about the lochia, we should know what is called as lochia rubra, then what is lochia spirosa, and next is the lochia alba. Then to prevent the contamination or infection, and we should not forget to assess the RIDA scale, that is R for redness, E for edema, and next second E for ecchymosis, D for discharges, A for approximation of the suture. The approximation of the suture line means if there is any gapping between the sutures. Next is to prevent ascending infection into the urinary tract in the patients with the indwelling catheter, as they are more prone to get the urinary tract infection. Next is to minimize pain, tenderness, and edema due to the operational trauma, that is because of the episiotomy. So next is, what are the articles that are required to provide the episiotomy care? That is, first, a sterile set containing medium-sized ball, a pair of dissecting forceps, a pair of dressing forceps, cotton swabs, gauze pieces, and dressing pad or sanitary pad. So these are all used to give perineal and the episiotomy wound care. The next is the sterile glove. It is used to protect the healthcare provider and also prevent from the spread of infection. Next, we should have bandage to secure the pad in the place. Next is a top sheet to cover the patient, a draw sheet and a plastic sheet, or in case if we have Macintosh, then we can use it. So this is to protect the swelling of the bed linen. The next, we should have warm water in order to clean the perineum. Then bed fan. So this is in case if the woman is not able to perform the perineal care herself. So next is preparation of the patient and unit. So first is we have to explain the procedure to the patient. Then we have to arrange the article required for the procedure in the nearby bedside. Then ensure that there is adequate lighting to observe the wound and discharge. If the lighting in the delivery room is dim, it is advised to arrange the adequate lighting. Like if we have some focused lighting on, we can use it. Then arrange dry heat lamp is available. So now, what are the procedure of giving the episiotomy wound care? So first of all is we have to inform the mother about the procedure. So this will help us in gaining cooperation. Then next is ask the mother to empty the bladder and also explain why. So this is to avoid interference during the procedure. It also helps in contraction of the uterus. The next procedure is request the mother to wash the perineum with the water in case if she is able to. If she is not able to, we have to provide the perineal care. So the purpose of this is for proper visualization of the wound and also the lochia. Next step is keep 1:100 strength antiseptic solution ready for the purpose of perineal care. Then dip 8 to 10 sterile cotton balls in prepared solution. So the purpose of these two steps is to provide perineal and the wound care. The next step is spread the Macintosh and draw sheet underneath the mother. So this is in order to protect the bed. Assist the mother in lying comfortably on the bed or on the examination table near the edge. So this will help in promoting comfort for the mother. Provide privacy by pulling the curtains, or if we have screen, we can use it for providing the privacy. Next is arrange the articles for perineal care and PV examination near the bed so that it will help us in saving time and energy. Stand at the right side of the mother for easy conduct of the procedure. Request mother to uncover the perineal area. Explain the need and cover her with a clean topsy. So this will help in providing privacy as we are not exposing unnecessary area. The next is perform hand washing procedure to prevent the spread of infection. Then put on the sterile glove on examining hand, following scientific principles, and use the clean hand to uncover the perineal area. So this will help to prevent the spread of infection. So after uncovering the perineal area, then we should carefully observe the Rida scale. As we mentioned, what is the full form of the Rida, and this will help to find out any abnormalities. The next, observe the color of the lochia, amount, and consistency. Then ask the mother regarding number of the pad changes per day to know the quantity of the blood loss. Then clean the episiotomy wound with a clean gauze soaked in the antiseptic solution with one straw. We should not repeat the same cotton for the next straw. Take different gauze. If another straw is required, do not repeat with the same gauze to help in preventing the spread of infection. The next, after completing this, pat the perineum dry by using the gauze pins and instruct or help to use the clean sanitary pad. So if she is able to wear or put on this clean sanitary pad, then she can do it. Otherwise, we can help or assist in doing so. Now, aftercare, what are the procedures that we have to do? Steps we have to do. First is discard the glove and wash hands. Then assist the mother in getting down, dressing, and grooming. Then replace all the articles and keep it ready for the next use. Then wash hands, document the procedure, inform the mother regarding the finding about healing of the episiotomy wound, and also clear her doubts. So today we have discussed about the care of the episiotomy wound. Thank you.